we're trying to match that MSE expansion with tooth-borne expansion on the upper right quadrant using SFOT. Hey guys, so it's been exactly 3 weeks since I did my SFOT procedure with Dr. Rabinowitz, and I wanted to give you an update. I'm totally in the clear with regards to healing. I believe swelling is at 0, my wounds are completely healed, I feel no pain, no discomfort, and truthfully it's been this way for at least a week, maybe 9 or 10 days even. I really think that 95 to 99% of SFOT healing occurs within the first 2 weeks, or at least it did with me, with all the measures that I took to accelerate healing, such as 2 days of fasting, eating clean, and just taking utmost care of my body. No antibiotics, no antiseptic oral rinse, just a 2-day fast, living my best, healthiest life, getting back on my exercise regimen within a week, and letting my body do its thing. I'm also on tray 12 out of 21 now. Before SFOT, I was on tray 6, and in the past 3 weeks, I've gone through 6 trays in 18 days. After the procedure, I did take a couple days off. That's why it's not 7 trays. As you know, I'm changing trays every 3 days. Let's take a look at my face and the surgical site, and we'll go from there. So remember, the procedure was on this side. Let's check the swelling. I don't know if you can see whether or not the expansion is starting to become noticeable. I do have another 10 trays to go. Remember, we're trying to take this side, eliminate the buccal corridors, and get it to match that left side well. The left side, of course, was expanded quite robustly with MSE back in 2019. The right side did not expand nearly as much, and now I'm trying to fix that with SFOT. I do have my upper tray in. I'm not even wearing lower trays throughout this process. I find that wearing 2 Invisalign trays at the same time causes me to clench really bad, which I hate, and the whole point of everything that I'm doing is to be healthier, feel better, get better sleep, clench less. So, this is a multi-month process, and I don't want to wear 2 Invisalign trays at the same time, at least not for an extended period, when essentially the lower tray is serving as a glorified retainer since we're not doing a lot of movement on the lower teeth. Let me see if I can peel my lips back so we can get a better look at the surgical sites. So, you probably can't even tell I had surgery. Let's take a look at my gum graft. I think the gum graft is integrating very nicely as well. Let's see if we can get the maxillary. He sliced on the maxillary side too and scored the bone in there in order to loosen things up so the teeth could move. And remember, for the gum graft, he took slices from my pterygo maxillary area, which is the big chunk of area behind my upper last back teeth. And I totally forgot he even did that, even though he took slices that were, the size of the ginger that you put on sushi. And it even looked like that. Similar color, similar shape, and sort of texture. Anyway, 3 weeks out from SFOT, I'm feeling like $1 million, waiting to see what my mouth is going to look like after I'm through my 21 trays. So far, it's good. Another observation I definitely want to put out there, you don't feel the trays when you change them, even though you're changing them every 3 days. The SFOT loosens the area up and makes it so easy for the trays to move your teeth that you hardly feel a thing. I mean, normally I struggle tremendously with Invisalign trays. After I change my trays according to normal Invisalign schedule without SFOT every, let's say, 10 days, it's like for 3 days I'm suffering from the agony of the tooth movement from the new tray. With the SFOT, I feel almost nothing. It's really remarkable. Even for people who don't need huge amounts of expansion, I still think SFOT can be a good treatment modality for getting faster Invisalign treatment, more pain-free Invisalign treatment. Obviously, you're front-loading a bunch of pain and sort of misery into that first week or 2 of the SFOT procedure. Obviously, there's a cost associated with it. For me, it was $6,000 for the SFOT and the gum graft, but the SFOT by itself for 1 quadrant was about $2,500, I think. So for 4 quadrants, probably 10 grand. Obviously, that's a lot of money, but depending on your budget and your priorities, it cuts your treatment time down to a 20% of what it normally would be, cuts the pain of the tray changing down to 20% or less of what it normally would be. So depending on your budget, your priorities, maybe it is something for you to consider. I've enjoyed the benefits of SFOT tremendously just in terms of comfort of my Invisalign treatment, and hopefully we can get the nice expansion results too. We'll know more about that in about a month when I'm finished all 21 of my trays. Check in with y'all soon. Maybe in a week from now I'll do a 4-week update. Peace. All right, what up, what up? It's been a month and a half since my SFOT procedure. Today is December 6th. My procedure was on October 19th. And guess what? It's time for tray 21 of 21, my last expansive Invisalign tray with SFOT. If you remember from my first SFOT video, this tray didn't fit at all. I showed you how I was gonna be expanded gradually over the course of, 21 trays till finally this one fit. Well, let's see if it fits. Here it is right here, tray 21 of 21, and let's pop it in and see if we can get it to slide in. And there it is. It fits. So let's take a look at the results of my SFOT. This is my last expansive tray, and let's see how we did. We're going to see Dr. Ilya Lipkin on Friday, the 8th, to check me up, to see how my progress went, and we'll see what's going to come next. Maybe another round of Invisalign trays to just round things up, and hopefully I'll be nearing the end of my orthodontic journey shortly thereafter. It's been over 7 years. I think maybe one more round of Invisalign tray to put some finishing touches on everything, maybe tuck in the lower right segment a little bit to get it into a nice, good bite there. Otherwise, I'm feeling like I'm real close to the end here, except for my future MMA surgery, of course. All right, it's February 1st, 2024. I'm exactly 3.5 months out from my SFOT procedure on my upper right quadrant. The reason I did that procedure was because when I did my MSE, I got disproportionate amounts of expansion on the upper left side as opposed to the upper right quadrant. The upper right quadrant remained lacking. The upper left quadrant was maybe 5 or 6 millimeters more expanded than the upper right quadrant following the MSE. Okay, it was an asymmetry. The expander pushed my upper left side much more than my upper right. So there I was. Even 3 years later from my MSE, I still had an asymmetry favoring the upper left side being more expanded than the upper right. That's after 3 years of post-MSE orthodontics. Okay, that's how devastating an MSE asymmetry can be. They're extremely difficult to recover from orthodontically. It takes years. And then even after years, you're still left in a position where your only choice to really get a next level smile, which probably is still going to remain permanently suboptimal, but level up from just basic orthodontics after an MSE asymmetry, you can inject in some SFOT. And that SFOT lets you take that underexpanded quadrant and expand the piss out of it one last time. Tooth-borne with Invisalign. It's not at all like MSE expansion, okay? It's dental movement, not maxillary skeletal movement. So even though the SFOT lets you cheat and get a little bit of dental expansion, your nasal cavity on that right side is unaffected by the SFOT and the orthodontics, so it's a lesser quality product as compared to a MARPI or an MSE or an EVES, right? But it's better than nothing when it comes to cosmetically optimizing the smile, which is why I did it. So I'm on my way to see Dr. Lipkin right now for my second follow-up since doing SFOT. I've done 28 trays of Invisalign since doing SFOT exactly 3.5 months ago. The first 14 were part of one round of Invisalign trays that Dr. Lipkin gave me that I had actually begun before I even did my SFOT. I was a 21 tray package. I was on tray 8 when I did my SFOT. So I zipped through 14 more trays in that first round up to tray 21, changing my trays every 3 days. I finished that. I went in for a follow-up with Dr. Lipkin in early December 2023. Dr. Lipkin said, all right, the smile is now edge to edge on that right side. We had bumped it out with 21 Invisalign trays to the point where it was edge to edge on that right side. If I had to guess, maybe 1 millimeter of real expansion of that right quadrant. He said, we're almost there. I want to do a little bit more. At my December visit, he scanned me up and he ordered me 14 more Invisalign trays. I received them 2 weeks later. It was an incredible turnaround by Dr. Lipkin's office. To plan that second round of Invisalign in the Invisalign software, Dr. Lipkin did that himself, of course. Then to have the order placed with Invisalign, to have it delivered to Dr. Lipkin's office, and then from his office, USPS priority mail to me, all of that in 2 weeks. Thank you, Dr. Lipkin. You are top notch, and you have always been expedient and precise in my treatment. up to this point, and also respectful of the fact that I'm commuting 4 hours. He shipped the package to me quickly so that I didn't have to go from Boston to New York just to pick up 14 Invisalign trays. Time is money, especially for me these days, burning at both ends. So I received that package in late December, and I zipped through those 14 trays in 3 days a piece. I'm going to see Dr. Lipkin for my second follow-up to see what he thinks. Now, looking at the bite, it doesn't look perfect to me. There's a few things. First of all, I think that the quality of the final orthodontic aesthetic result that I can achieve is going to be limited by the MSE asymmetry that I experienced in the skeletal nature of that asymmetry, which can only be cloaked over so much with dental expansion, Invisalign and SFOT. I think it's just too much of an uphill battle to get a perfect aesthetic product after an MSE asymmetry, but it's a hell of a lot better than it was. First of all, when I started treatment with Dr. Lipkin, and then additionally, since the SFOT has helped. It's really bumped out that upper right quadrant. So let me shut the fuck up for a second and just show you what the smile looks like now, and my editor will maybe cut in some footage from right before I did SFOT so that you can see the magnitude of the expansion that the SFOT enabled, okay? So this was the under-expanded side. This is the side we did SFOT on, and if I'm not mistaken, the buccal corridor on this side, which is to say the black triangle that's optically created as a result of the narrowness of the smile, I believe the buccal corridor is significantly better on that right side and now more closely resembles the ultra-expanded left side that had gotten the MARPI expansion back in 2019. So let me just show you again. Still a buccal corridor, and buccal corridors are definitely tremendously affected by the lighting of the shot. So depending on which way the sun is coming and which way the shadow is created, although it's overcast as fuck right now, so there's really no shadows being cast. This is perfect video lighting. Now, here's what the SFOT has not corrected. And by the way, Lipkin is not done, and I have a feeling that today he is going to order another 14 or 15 Invisalign trays. And on this final round of Invisalign, I suspect that what Dr. Lipkin is going to do is he's going to try to drop the right side a little bit. The premolar on the right side is high compared to the premolar on the left side, and maybe the canine or maybe the first molar as well could be extruded and dropped slightly on that right side, and I think that'll help address the remaining imperfection in my smile, which is the cant, okay? I think I still have a maxillary cant in which the left side is slightly dropped with respect to the right side, and I think if we drop the premolar at least maybe a half millimeter, I think it's going to help aesthetically with the cant. Also, that tooth just doesn't have contact right now. So I believe Dr. Lipkin's strategy with the post-SFOT orthodontics has been to just expand as much as we want and then clean it up. And so the first two rounds, 21 trays, then the 14 trays that I just finished, I believe they were expansion purely, where he was just trying to see how far he could get the upper right teeth to go with respect to the lower teeth and get them into a good bite where they can actually maybe even be tipped in a little bit, so that they're not just over and under with the bottom right teeth. So I think expansion is done. Now I think where we're at is cleanup. Now, even after the cleanup of this next round, I don't expect my smile to be perfect. I believe that the skeletal cant that was created by the MARPI pushing that left quadrant, because it didn't just push it more in an expansive way, it also pulled it down a little bit. And I think that was skeletal, and you can only do so much dentally to mitigate the cant that's created when half of your maxilla gets dropped. I mean, let me ask you, can you see my maxillary cant? See, I think you can see on this side, it's a little bit more rolled down, and that side was so expanded that the upper teeth on that side are actually tipped in pretty aggressively to get them back into a bite. I mean, that's a big part of what my orthodontics has been the last 4 years, was cranking in those upper left teeth that got hyper expanded by the MARPI, where the whole bone was pushed out and dropped down. Now it's way better than it was. It's an incredible accomplishment that we've done over the last 4 years, getting that quadrant back into a bite. But what's it look like to you? I think still a little rolled down, and then these teeth have been expanded to match, but you can tell it's dental. I mean, the upper left gums are hyper expanded, which indicates that the basal bone, the alveolar ridge, the whole thing moved with the MARPI. Whereas on my right side, yes, the teeth are expanded, but the gums are definitely not as expanded as the left side. So here the teeth are tipped out, here the teeth are tipped in. So it's almost like my maxillary teeth are like a parallelogram as a result of the skeletal expansion on one side and the dental expansion on the other side. But maybe I'm seeing things, and maybe even that's going to be corrected with my next and probably final round of trays from Dr. Lipkin. But we'll see. I just left Dr. Lipkin's office where I had follow-up after my second round of Invisalign trays following SFOT. And what did he do? What did he say? He said things are looking better. That upper right quadrant is almost where he wants it to be. There's one small area that still needs to be expanded a bit, and we are going to drop that one tooth to try to even out the cant, this tooth. Alright, so just as expected, probably another 15 Invisalign trays coming. I'll have them in probably 3 weeks, and then I'll do them at a rate of 3 days per tray, and then I'll see Dr. Lipkin 45 days after that. I think maybe one more after this. I mean, this could be it. This could be my last round of Invisalign trays, but I have a feeling one more, and then at that point, we'll really take a close look at my smile. I'm going to get some before and afters organized. I'm going to ask Dr. Lipkin for all the photos and images they took of me throughout my whole treatment, and I'm going to do a nice before and after presentation to see the true efficacy of SFOT. I've been very pleasantly surprised by the improvement to my neck tension, upper right side of my neck, back here and in my right shoulder blade and in my right trap. The tension there has been relieved very nicely by the SFOT and the expansion of that upper right quadrant via Dr. Lipkin's Invisalign trays. Now, I was not expecting that at all. In fact, I was pretty content with how much improved my neck tension had already been with all of the intervention I've had over the last 10 years, including 2 migraine nerve decompression surgeries at the back of my neck and MSC in 2019, which improved my airway and therefore improved my nerd neck posture. It allowed me to elongate my neck posture instead of being like this, because of course nerd neck posture is a cope for a small airway. So I had no idea that the SFOT would have any effect on the small amount of tension that remained at the upper right side of my neck in the area of the right lesser occipital nerve, sort of below and behind the right ear. But I think what's happened is that by dentally expanding that upper right quadrant and giving my tongue more space on that upper right side, that somehow has flowed downstream to the musculature of my neck and shoulder on that side. And I guess it was the missing link. When I was having headaches and tension severely, like every other day for several years between say 2012 and 2018 or so, it was one big headache for all of those years, more or less. And 80% of those headaches were on the right side. And I think that a big part of that had to do with the fact that my upper right maxilla was super narrow, and it remained narrow after my MSE because the MSE disproportionately expanded my upper left side. It wasn't until we did SFOT and Invisalign with an emphasis on bumping out that upper right quadrant that I've since had some relief in the tension in that area. Was not expecting that, was not looking for that. It's just been a total icing on the cake. I mean, I did SFOT for, you could say, aesthetic and occlusal purposes, to have a more even smile, to have a smaller buccal corridor on that right side because there is no buccal corridor on the left side because the MSC expanded the piss out of it, and to eliminate the crossbite that remained on the upper right side. My upper right teeth were biting inside of the lower right teeth. The cusps of the upper right teeth were inside of the outside cusps of the lower right teeth. So I did SFOT to correct those things, aesthetics and occlusion. I did not do it to improve my neck pain, but improvement of neck pain is in fact what I've experienced, and I'm very happy. And it just goes to show, man, that having small jaws, you just never know how it's impacting you in a negative way. It's like, for me, so many of the weird issues that at one point in my life I had written up to me just being a anatomically abnormal handicap, essentially. My neck pain, my headaches, all of that seems to have been intricately connected with my underdeveloped jaws, and as I continue to expand my jaws, well, that expansion is pretty much done now with the SFOT, unless I have a double jaw surgery at some point in the future. But the expansion I've done up to this point has solved those problems. Small jaws are truly an insidious epidemic as they wreak havoc on your health in all of these mysterious ways, and then when you go to get treated for them by a neurologist or by whoever, physical therapist, an ENT, who else? In my case, a plastic surgeon who did a migraine nerve decompression surgery for me. What you're getting from these people is treating the symptoms, but the root cause is often a tension that is rooted in your mouth and then in your neck, second in line from there. So very happy with my neck pain relief that I've had with SFOT and expansion of the upper right quadrant with Invisalign trays following SFOT. Hope you enjoyed that. All right, so I met with Dr. Lipkin 8 days ago on February 1st for my second follow-up after SFOT, where he took a new Invisalign scan for me. 9 days later, my Invisalign trays have arrived from Dr. Lipkin's office. I don't know how he managed to turn that around so quickly, design the ClinCheck, have the ClinCheck sent to his office, and then from his office, USPS priority mailed to me up in Boston. All of that in 9 days. That's A+ customer service. Lord knows I've waited absurdly long times for Invisalign trays to come in from prior orthodontists, etc. So very grateful for that expedient turnaround, because remember, we're trying to take advantage of the SFOT, and the SFOT has a time limit where that site is going to be activated in a way that I can kind of push it with expansion. So we're on the clock. Dr. Lipkin has been extremely punctual and expedient in his delivery of my Invisalign trays after ordering them. So let's open this up and see what's inside. Okay, here we go. Oh wow, the trays are just in this USPS priority mail box. So we have 26 trays. I have one of 26, and up here 26 of 26. And I wonder if I'm still changing my trays every 3 days. A note from Dr. Lipkin's office. Hey Ron, please change every 5 days. Be well, and we'll see you soon. Thanks from Dr. Ilya Lipkin Orthodontics. Okay, so what this tells me is Dr. Lipkin must feel like the SFOT site is not tender enough anymore to be able to push it with changing trays every 3 days. It's looking like maybe there's some deceleration there, and we gotta change trays every 5 days now. So 26 times 5, that's 130 days. So about 4 months and change. So it looks like I'll be seeing Dr. Lipkin again at the end of June. Very good, very good. I'll take my time with these. Now, I do have access to my ClinCheck video for these, and I'm gonna edit that into the video right now, and what you'll see is that Dr. Lipkin plans continued expansion of that upper right quadrant, and it looks like he's also gonna drop that upper right quadrant to try to continue to even out my cant, because right now my left side is lower. He's gonna bring the right side down with the Invisalign trays, try to even it out and bump it out some more, which I think is bold because it looks like he's trying to evenly match the left and right sides, which is a big ask because remember, the left side got absolutely expanded out to the next galaxy with MSE, whereas the right side got nothing. We're trying to match that MSE expansion with tooth-borne expansion on the upper right quadrant using SFOT, and now my third set of Invisalign trays. In total, we have 35 trays from 2 prior sets plus 26 trays here, 61 total trays into my SFOT. And will this be the last set? I don't know. I could definitely see another refinement set after this. But if you look at the ClinCheck, you'll see it looks like Dr. Lipkin is planning for this to be the last one. One thing I like to do with these expanding sets of Invisalign trays is take the first tray and last tray and just physically compare them to see the amount of expansion that's planned into them. So here I have tray 1 of 26. Here I have tray 26 of 26, and I'm just curious to see how much more expanded on that upper right side tray 26 of 26 is, because on the ClinCheck video, it looks pretty dramatic. So let's just compare it. All right, here's the difference between tray 1 and 26. So now tray 26 is up front and tray 1 in the back, and you can see that's the expansion that I'm going to get. Looks like on that back tooth, the second molar there's quite a bit of expansion. I mean, that's a couple millimeters. So there you have it. If this set of Invisalign trays goes to plan and my teeth track according to the ClinCheck, my maxilla should get that much wider, especially on the upper right side, over the next 4 months. All right, check y'all soon. I'm going to start with my first tray right after breakfast. Tray 1 of 26 of my third set. Peace out.